Have you ever felt something was wrong with your body but couldn't identify what it was? Have you had that strange feeling that your heart might not be working as it should? What if I told you there are signs your body gives when your heart is not well, and identifying these signs can be the key to preventing more serious problems? Stay with me until the end, because today we are going to uncover the 8 signs your body shows when your heart is not well and the 8 indicators of heart problems.
Hello, I'm Dr. Phil Can, then a YouTube enthusiast in my spare time. On this channel, I give valuable tips on how to build a better and healthier life. So, if this topic interests you, click the bell right now so you don't miss any new videos and stay updated with all the news. But now, without further ado, let's get to the video.
So let's get straight to the point. Extreme fatigue. Extreme fatigue is something many of us experience occasionally, perhaps after a long day or sleepless nights. However, if you feel tired all the time, even after a good night's sleep, this could be a sign that something more serious is happening, specifically with your heart. Extreme fatigue can indicate that your heart is not pumping blood efficiently. The heart, as the vital pump of our body, is responsible for ensuring all our organs and tissues receive enough oxygenated blood to function properly. When it can't meet this demand, the body needs to compensate in other ways. Imagine your body as a city and the heart as the main water treatment plant. If the plant can't pump enough water, some areas of the city will start to have problems. Similarly, when the heart is not functioning properly, it cannot send enough blood to meet the body's needs. This means that less oxygen and nutrients are delivered to the cells, which can lead to fatigue. Additionally, when the heart is overworked, it needs to work harder to try to compensate, which consumes more energy. This constant overload can leave you feeling exhausted. It's also important to remember that extreme fatigue can be a symptom of various heart conditions, including heart failure, coronary artery disease, and arrhythmias. Therefore, if you are constantly tired for no apparent reason, it is crucial to seek medical help to investigate the underlying cause. Shortness of breath. Feeling short of breath after light activities or even at rest is another sign that your heart might not be working properly. Shortness of breath, known as dyspnea, can occur when the heart cannot pump enough blood to meet the body's needs, especially during physical exertion. Normally, when exercising, your muscles require more oxygen, and your heart needs to increase the amount of blood it pumps to meet this demand. If the heart is compromised, it cannot increase this blood flow adequately, resulting in shortness of breath. Shortness of breath can also be a sign that blood is accumulating in the veins returning to the heart, causing pressure in the lungs. This can happen in heart failure, where the heart cannot efficiently pump the blood returning from the lungs, leading to fluid buildup in the lungs, pulmonary edema. This accumulation makes breathing difficult and can make you feel constantly breathless. Moreover, problems with the heart valves, which control the blood flow between the different chambers of the heart, can also cause shortness of breath. When these valves do not function correctly, the blood flow is disrupted, and the heart has to work harder to compensate, resulting in difficulty breathing. Feeling short of breath can be frightening and should be taken seriously, especially if it is persistent or occurs for no apparent reason. Swelling. Swelling in the legs, ankles, or feet can be a sign of heart failure. When the heart does not pump blood effectively, blood can accumulate in the veins, causing fluid retention and swelling. This swelling, known as edema, is a common symptom in people with heart failure, a condition in which the heart is unable to pump enough blood to meet the body's needs. Edema occurs because the decreased efficiency of the heart leads to a buildup of pressure in the veins, causing fluid to seep into the surrounding tissues. Gravity causes this fluid to accumulate in the lower parts of the body, such as the legs and ankles, especially if a person is standing or sitting for long periods. Additionally, heart failure can affect the kidneys, reducing their ability to eliminate sodium and water from the body, further contributing to fluid retention and swelling. Swelling is not just a cosmetic or uncomfortable problem. It can be a sign that the heart is under significant stress. Ignoring this symptom can lead to more serious complications, such as advanced heart failure, where the heart's ability to pump blood is severely compromised. If you notice persistent swelling in your feet, ankles, or legs, especially if it is accompanied by other symptoms like shortness of breath or fatigue, it is crucial to seek immediate medical attention to assess heart function. Irregular heartbeat. Have you ever felt your heart race or beat irregularly? Irregular heartbeats or arrhythmias can be a sign that something is not right. The heart has an electrical system that regulates the rhythm and frequency of heartbeats. When there are problems in this system, the electrical signals can become irregular, resulting in fast, slow, or disordered heartbeats. There are many types of arrhythmias, and while some are benign, others can be dangerous. For example, atrial fibrillation is a common arrhythmia that can increase the risk of stroke and heart failure. In some cases, arrhythmias can be a sign of underlying heart disease, such as coronary artery disease, where the arteries supplying blood to the heart are blocked or narrowed. They can also result from cardiomyopathy, a disease of the heart muscle, or conditions that affect the heart valves. The symptoms of arrhythmia can range from a mild, fluttering sensation to more severe symptoms like dizziness, shortness of breath, chest pain, or even fainting. It is important not to ignore these sensations, as early diagnosis and proper treatment can prevent serious complications. If you experience irregular heartbeats persistently, seek a cardiologist for a complete evaluation. Chest pain. Chest pain, especially if intense or persistent, is one of the most well-known signs of heart problems. It can be indicative of angina or even an impending heart attack. Angina is chest pain caused by reduced blood flow to the heart muscle, usually due to a blockage or narrowing of the coronary arteries. This condition can cause a feeling of pressure, tightness, or pain in the chest that may spread to the shoulders, arms, neck, jaw, or back. A heart attack, on the other hand, occurs when the blood flow to a part of the heart is completely blocked, causing damage to the heart muscle. The chest pain associated with a heart attack is generally more severe and prolonged than angina, and may be accompanied by other symptoms like shortness of breath, cold sweat, nausea, or fainting. Chest pain should never be ignored, especially if it is new, intense, or lasts more than a few minutes. Seeking immediate medical help can save your life. Dizziness and fainting. Dizziness or fainting can occur when the blood flow to the brain is inadequate, which can be a sign of heart problems. If you frequently experience these symptoms, it is important to seek medical attention. Dizziness can be caused by various heart conditions, including arrhythmias, where irregular heart rhythm interferes with the proper blood flow to the brain. It can also be a sign of hypotension, where blood pressure is abnormally low, resulting in insufficient blood flow to the brain. Fainting, or syncope, can be particularly concerning when related to heart problems. It can occur due to a sudden drop in blood pressure, a decrease in heart rate, or a temporary failure of the heart to pump enough blood to the brain. Conditions such as aortic stenosis, where the aortic valve is narrowed, or hypertrophic cardiomyopathy, where the heart muscle is abnormally thick, can also cause fainting. If you faint or feel dizzy frequently, it is crucial to undergo a thorough medical evaluation to identify and treat the underlying cause. Paleness. Paleness, or a bluish coloration in the extremities, can indicate that your heart is not pumping oxygenated blood efficiently. This can be a sign of underlying heart problems. Paleness occurs when there is a reduction in blood flow or the number of red blood cells carrying oxygen throughout the body. This can be caused by various heart conditions, including heart failure, where the heart cannot pump blood effectively, resulting in inadequate circulation of oxygenated blood. Additionally, problems with the heart valves or arterial diseases can restrict blood flow, causing paleness. Cyanosis, a bluish coloration of the skin, occurs when there are insufficient oxygen levels in the blood, often due to serious heart problems that compromise proper blood oxygenation. If you notice changes in your skin color, especially if accompanied by other heart symptoms, it is essential to seek immediate medical attention. Persistent cough. A persistent cough or wheezing, especially when accompanied by pink or white mucus, can be a sign of heart failure. This occurs when the heart cannot keep up with the body's demands, resulting in fluid buildup in the lungs. When the heart cannot pump blood effectively, blood can accumulate in the veins returning from the lungs to the heart, causing increased pressure in these veins and resulting in pulmonary edema. The fluid buildup in the lungs can cause a persistent cough, which may be particularly noticeable at night or when lying down. The pink or frothy mucus is a sign that there is fluid present in the lungs, and this should be treated as a medical emergency. Additionally, wheezing can indicate that the lungs are congested with fluid, making breathing difficult. If you have a persistent cough, especially if accompanied by mucus or wheezing, it is important to seek medical attention to evaluate heart function and initiate appropriate treatment. Important note: all this information is for informational purposes only and should not be taken as a diagnosis. If you exhibit any of these symptoms, it is essential to consult your trusted doctor for proper evaluation and guidance. Indicators of heart problems. High blood pressure. High blood pressure, or hypertension, is one of the main indicators of heart problems and a significant risk factor for developing cardiovascular diseases. Hypertension occurs when the force of the blood against the artery walls is consistently high, forcing the heart to work harder to pump blood throughout the body. Over time, this overload can lead to damage to the heart and blood vessels. When the heart is forced to pump against higher pressure, it can become thicker and stiffer, a condition known as left ventricular hypertrophy. This can reduce the heart's efficiency and increase the risk of heart failure. Additionally, hypertension can cause damage to the arteries, making them stiffer and narrower, which can lead to even higher blood pressure and a greater likelihood of blood clots. Hypertension is often called the silent killer because many people do not show symptoms until the condition has caused significant damage to the body. That is why it is crucial to regularly monitor blood pressure, especially if you have risk factors such as a family history of hypertension, advanced age, a diet high in salt, lack of physical activity, or obesity. Managing high blood pressure typically involves lifestyle changes, such as adopting a healthy diet rich in fruits, vegetables, and whole grains, reducing salt intake, exercising regularly, maintaining a healthy weight, and avoiding excessive alcohol consumption. In some cases, medications may also be necessary to help control blood pressure. Consulting a doctor is essential to determine the best approach to managing hypertension and protecting heart health. High cholesterol. High cholesterol, particularly elevated levels of LDL cholesterol, the bad cholesterol, is another crucial indicator of heart problems. LDL is responsible for transporting cholesterol throughout the body, but when its levels are too high, it can accumulate on the walls of the arteries, forming plaques. This process is known as atherosclerosis and can restrict blood flow to the heart and other parts of the body, increasing the risk of heart attack and stroke. Atherosclerosis can begin early in life and progress over the years without showing symptoms until an artery is significantly blocked or until a plaque ruptures, causing an acute cardiac event. Besides LDL, HDL cholesterol, the good cholesterol, plays an important role in heart health by helping to remove excess cholesterol from the arteries and transporting it back to the liver, where it can be processed and eliminated from the body. To maintain cholesterol levels within a healthy range, it is essential to adopt a balanced and nutrient-rich diet. Foods like fruits, vegetables, whole grains, nuts, and fish rich in omega-3 fatty acids can help reduce LDL levels and increase HDL cholesterol. Additionally, limiting the intake of saturated and trans fats, often found in processed and fried foods, is crucial. Regular exercise also plays a vital role in managing cholesterol levels, helping to increase HDL and lower LDL. For those who cannot control cholesterol levels through lifestyle changes alone, medications like statins may be prescribed to help reduce LDL levels and protect against heart disease. Diabetes. Diabetes is a chronic condition that affects how the body processes glucose, a type of sugar in the blood. People with diabetes have an increased risk of developing heart problems, partly because diabetes can cause damage to blood vessels and the heart. High blood glucose levels can lead to the buildup of fatty deposits in the walls of blood vessels, which can increase the stiffness and narrowing of arteries, a process similar to what occurs with high cholesterol. Additionally, diabetes is often associated with other risk factors for heart disease, such as hypertension and high cholesterol. The combination of these factors can significantly increase the risk of developing coronary artery disease, heart failure, and other cardiovascular complications. Properly controlling blood sugar levels is crucial for reducing the risk of heart problems in people with diabetes. This can be achieved through a combination of a healthy diet, regular physical activity, constant monitoring of blood glucose levels, and, if necessary, medications to control blood sugar. Adopting a balanced diet rich in fiber and low in refined sugars and simple carbohydrates can help maintain stable glucose levels. Moreover, it is important for people with diabetes to work with their doctors to manage other risk factors for heart disease, such as high blood pressure and cholesterol levels. This may involve prescribing specific medications to help control these additional risk factors. Obesity. Obesity is a significant risk factor for a variety of health problems, including heart disease. Excess weight puts additional pressure on the heart, forcing it to work harder to pump blood throughout the body. This can lead to the development of ventricular hypertrophy, where the heart muscle becomes thicker, and to heart failure. In addition to overloading the heart, obesity is often associated with other risk factors for heart disease, such as hypertension, high cholesterol, and type 2 diabetes. Excess adipose tissue, especially around the waist, can increase insulin resistance, leading to elevated blood sugar levels and the development of diabetes. Moreover, adipose tissue can release inflammatory substances that can damage blood vessels and contribute to the development of atherosclerosis. To reduce the risk of heart problems associated with obesity, it is crucial to adopt a healthy lifestyle that includes a balanced diet and regular physical activity. Losing weight, even modestly, can have a significant impact on reducing blood pressure, cholesterol levels, and the risk of diabetes, improving heart health. Effective weight loss strategies include reducing calorie intake, increasing the intake of nutrient-rich foods, and incorporating aerobic and resistance exercises into the daily routine. Obesity is a complex condition that can be influenced by a variety of genetic, environmental, and behavioral factors. Therefore, it is important to approach weight loss holistically and individually, seeking guidance from health professionals when necessary to develop an effective and sustainable action plan. Important note: all this information is for informational purposes only and should not be taken as a diagnosis. If you exhibit any of these symptoms, it is essential to consult your trusted doctor for proper evaluation and guidance. But the journey to a healthy body doesn't end here. In the next video, we will explore a question that many fitness enthusiasts ask: light weights or heavy weights? Which is better for building muscle quickly? Experts will reveal everything to you, so don't miss it. Click on the video appearing on your screen right now. Go.